And the next item of business is a statement by Jean Freeman on the rollout of testing programme. The Cabinet Secretary will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on Jean Freeman for up to 10 minutes. Please, Cabinet Secretary.
Thank you very much, Presiding Officer. Last week in this chamber, I updated members on our plans to deliver COVID vaccinations. Today, I'm grateful for the opportunity to update on our plans to significantly expand testing. This further expansion is possible because of increases in our testing capacity, coming from the 3 new NHS regional hub laboratories, from Lighthouse laboratories and from new testing options. Yesterday, the Glasgow Lighthouse Laboratory reached the remarkable milestone of 5 million tests processed. Work on our 3 new regional hubs in NHS Scotland is progressing, and I want to thank our microbiology, virology and healthcare science workforces who have built the largest diagnostic capacity and are a critical part of Scotland's COVID response. New options come from innovation in testing outside our labs, notably the new lateral flow devices, bringing us significantly greater capability to test more people more often. I will come on to how we will use this capability, but first I want to say a few words about the new tests. Lateral flow devices are rapid turnaround tests where samples are processed on site with no lab required, and results are available in under half an hour. The type we are using first in our expansion, the Innova lateral flow test, has had extensive clinical validation by Public Health England and Oxford University. This validation found that the Innova lateral flow test has an overall sensitivity of 76.8%, meaning it will identify more than 7 in 10 positive cases of COVID. That rises to over 95% of those with high viral loads, those who are likely to be the most infectious. Understanding this matters because, as we've consistently said from the outset, no test is 100% accurate, and testing on its own does not reduce transmission. It only helps to stop transmission through the actions taken following the result, to isolate if positive and give contact tracers all the information about where we have been in the period when we may have been infectious, so close contacts can be identified and told to isolate. All of that aimed at killing off the chain of transmission. So testing is one layer of protection. All the others, from reducing contacts, keeping our distance, wearing face coverings, enhanced infection prevention and control in our NHS and care settings, to vaccines when they come, all of them only work to greatest effect when they work together. Our senior clinical and scientific advisors recently reviewed our testing strategy, and their advice was clear and unanimous. Test people with symptoms, test for clinical care, and when capacity allows, prioritise to protect those most vulnerable from the worst harm. We now have that increased capacity and will extend testing now to many more people. By the start of December, we will extend testing for all hospital admissions to emergency departments, acute assessment centres, maternity units, emergency mental health units. By mid-December, we will extend that testing to all medical and surgical elective admissions. We will extend our routine testing of healthcare workers. Everyone working in patient-facing roles in all of our hospitals, the Scottish Ambulance Service, the COVID assessment centres in the community, and the healthcare professionals who visit care homes will receive twice-weekly testing. The scale of this challenge is not to be underestimated. NHS Scotland employs over 170,000 people, and while not all are in patient-facing roles, the number who are is considerable. We know our frontline NHS staff are at the highest risk of being exposed to COVID-19. We know when community transmission rises, so too does the risk of outbreaks in our hospitals. So we will phase in this extension from the start of December to be completed by the end of that month. I know that all those NHS staff who continue to deliver an extraordinary service and who understand so well all they need to do to protect themselves and the patients they care for will welcome this additional layer of protection. We will extend testing in social care. There are up to 42,000 care home residents across Scotland, all of whom are entitled to a designated visitor. We will use lateral flow testing on the day of the visit, so that if that test is positive, family members can take immediate action to isolate and avert the harm that could have arisen. We will roll out lateral flow testing to up to 12 early adopter care homes across 4 local authority areas from the 7th of December. Learning from that, we will roll out to a further number of homes across an additional 7 local authorities before the 21st of December, with full rollout across all care homes completed by over January and early February. So while this is positive progress, and I hope it is good news, I am mindful of the approaching Christmas period, and I don't want any resident or family member to be disadvantaged. So for those not included in the lateral flow early adopters before Christmas, we will provide access to PCR testing in the weeks beginning the 21st and 28th of December and the 4th of January. Family and loved ones know better than anyone else that testing provides an additional layer of protection. On its own, it doesn't give risk-free visiting, but combined with appropriate PPE and strict hand hygiene, I hope it allows more relatives to visit their loved ones, reduces isolation and loneliness for care home residents, and gives providers the additional confidence they need to facilitate more visits. There can be no question, Presiding Officer, that the home care workforce do one of the most critical jobs, supporting and caring for people so they can continue to live as independently as possible in their own home. From mid-January, we are extending our testing programme to them, including permanent and visiting staff and personal assistants to a person's home, and covering residential settings, sheltered housing and daycare. This is a large group of people doing very important jobs, but the very nature of the job they do means they work individually in a number of different homes and settings. So the logistics of this are not straightforward, and we will phase this in for care at home staff also from mid-January, starting in those local authority areas with the highest virus prevalence at the time and expanding out from there to cover the whole sector by March. With a significant capability now available to us, we are also extending asymptomatic testing to entire groups and communities to help us find positive cases even before a person develops symptoms. As members know, we are doing this first in partnership with our universities so that tens of thousands of students can travel to their family homes safely at the end of this term. All students leaving their term time address will be offered 2 lateral flow tests 3 days apart from next week. And as part of the details to be set out shortly for the staggered return of university students in the new year, testing will be put in place for them once more. All school staff can currently access testing if they are concerned they have been at risk from infection, and we have enhanced surveillance in schools undertaken by Public Health Scotland. But I know that as transmission has risen or stayed stubbornly high in some of our communities, especially those now in level 4, school staff may have had concerns about risk. We will maintain the current access to asymptomatic testing, but last week the Deputy First Minister also gave a clear commitment to explore extending testing further. I'm pleased to confirm that from the return of the school term in January, we will undertake a number of Pathfinder testing programmes on deliverability in the school environment, with the objective of establishing a sustainable programme of asymptomatic testing among school staff. Our testing capability now enables us to work with local partners to trial whole community testing in exactly those areas where transmission has stayed stubbornly high. Next week, we will be deploying up to 6 additional mobile testing units and 20,000 home test kits to support work in 5 local authority areas: Glasgow, Renfrewshire, East and South Ayrshire and Clackmannanshire. We will also set up an asymptomatic test site using lateral flow testing in Johnston in Renfrewshire, which has one of the highest new cases per 100,000 of any local authority in Scotland. This centre will have capacity to test up to 12,000 people over the course of the week. And we are actively planning targeted deployment for early January, including further asymptomatic test sites. In deploying mobile units, home test kits and trialling the asymptomatic test site, we will work closely with local communities to harness their expertise to encourage high participation. Presiding Officer, testing is undeniably important, but it is just one layer of protection. Many layers are needed to fight this virus. Our increased capability now to test more people more often is potentially powerful as we navigate our way through the coming months as safely as we can and alongside our nationwide vaccination programme. With the plans I have set out in this chamber today, we will move to testing hundreds of thousands of people without symptoms to actively find the virus and, with the continuing cooperation of people across Scotland, prevent and break down chains of transmission before COVID-19 can cause the harm we know it is capable of. Thank you.
The Cabinet Secretary will now take questions on the issues raised in her statement. We are pushed for time. I'll try and allow around 20 minutes for that. Can I please, first of all, call Donald Cameron?
Thank you, Deputy Presiding Officer. Can I thank the Cabinet Secretary for advance sight of her statement. We strongly welcome the further clarification provided on the expanded testing programme, and it's right that these actions are rolled out swiftly so we continue our efforts in suppressing the virus. And both the positive news about vaccines in recent weeks needs to be complemented by a robust and accurate testing regime. Both are critical tools. Can I return to the issue of testing in social care, both in care homes and for home care, given, as she acknowledges, the very difficult and emotional issues it raises, especially at this time of year, for relatives and friends? Can the Cabinet Secretary clarify whether designated visitor testing will be mandatory in all instances? And can she outline what support will be given to care homes to implement these new policies, given the importance of a uniform approach across Scotland and the fact that one of the hardest issues for relatives is dealing with differing rules applying in differing care homes?
Jean Freeman.
I thank Mr Cameron. It's a very important question. In terms of care homes and whether or not it will be mandatory, as Mr Cameron knows, we don't make testing mandatory. It's not mandatory for our NHS staff. And there's a very straightforward reason for that. We want people to voluntarily undertake the testing, particularly the lateral flow testing, because it is much more straightforward and much less intrusive and difficult for them, because they understand the importance and the rationale. So at this point, we have no intention to make it mandatory for care home visiting. We need to continue our discussions with care home providers through Scottish Care to ensure that care home providers feel, as they have asked for, they feel that testing gives them greater confidence to open up more visiting for their residents. In terms of support for care homes, there will be support for all care homes. The Pathfinder approach allows us to work directly with care homes, provide the training, make sure they understand how the lateral flow devices work, make sure we get the logistics of kit delivery accurate and smooth, and then use their experience with us to roll that out to their colleagues who are running the additional care homes. So training and support will be provided to all care homes as lateral flow devices are rolled out to them. And of course, PCR is done through our NHS.
Monica Lynn.
Thank you, Presiding Officer. On the surface of it, there's quite a lot in the statement to welcome, but of course the devil is in the detail, and people have been promised a lot on testing already. Just to pick out a couple of things, because the Cabinet Secretary has recognised that our frontline workers are at higher risk and they do really important jobs. But I see from the statement, and I think I've written it down carefully, that it will be the end of March before everyone working in home care has access to testing. That's a year since we went into the pandemic. So that just seems completely unacceptable to me and the colleagues in these benches. It's really worrying. We're seeing nosocomial infection spread in our hospitals. We see it spread in the community into care homes. So again, it's a worrying time for our frontline workers. So can I ask why it's taken so long to roll the testing out? And on the welcome update on whole community testing, Can I ask, given the high number of cases in Lanarkshire and given our level 4 status, why hasn't Lanarkshire been selected for whole community testing and what criteria is being used?
Jean Freeman.
A number of things. I don't think I promise a lot and then don't deliver. The reason why you're getting this update today and not at any other point when it would have been entirely possible to make an announcement, it would have been an announcement with no substance. Today we have a detailed delivery plan. Today I'm confident the dates I am giving are the dates that we will deliver on. I think that the public in Scotland, and more importantly, those who need that testing, that is the respect that they deserve. In terms of NHS staff, all patient-facing NHS staff, as I have described, will be undergoing routine weekly testing by the end of December. So that's in a month's time. The problem with home care staff, it's not a problem, but it is the nature of the job, is that they don't conveniently gather in one place on a regular basis before they go and do their job. And so we need to work out the logistics of this. If we can deliver it before March, then we will do that, because I completely recognise the vitally important work they do, and the fact that they will very often visit 5, possibly more homes in any one day, and they do have arrangements for PPE. But the other point about home care staff is, I think First Minister explained it yesterday, in terms of the authorisation for non-clinical use of the lateral flow test. The lateral flow test is the best to use in these circumstances because of the speed of the result. But at the moment, there isn't yet across the UK authorisation for anyone who isn't clinical to use that test. So we can make sure that it is used in care homes where we have nursing staff. We can obviously use it with our NHS staff, with all those admissions to hospital. Home care workers are different, so to make it smooth, to make it something that is part of your shift and not something that you have to go on your day off to get, we need to get that authorisation in place to help us roll it out even further. So the two areas are the areas of complication, the nature of the job and the fact that we don't conveniently find them in a ward or in a care home, and the authorisation for widespread non-clinical use. That's the difficulty. And as I've said, if we can do it quicker, we will do it quicker. But at the moment, our current estimate, based on those two issues, is that it will, starting in January, it will take us to March before we complete it.
We really are pushed for time, so I must insist on concise questions and answers, please. Annabel Ewing, followed by Brian Whittle.
Thank you, Presiding Officer, and I too would wish to add my welcome to the significant expansion of the testing programme. Can I ask the Cabinet Secretary what discussion the Scottish Government has had with NHS Fife and with Fife Council to ensure that health and social care staff in my constituency of Cowdenbeath can access testing close to their community?
Jean Freeman.
So NHS staff will be able to access testing either directly in their workplace or as close to the workplace as the Health Board and ourselves can organise that. So, for example, in some of the community settings, it may be in one community setting and everyone needs to go there. But I am very keen. It is part of the shift pattern and not something people have to do on their days off. In terms of social care, I've already explained some of the issues to Ms Lennon. But where we have social care staff directly employed by local authorities, unfortunately, in my opinion, not often enough and not many enough, but where that is the case, then that is logistically more easy to organise. And we will be talking to Fife Council and others to make sure that we can do it in shift as close to the workplace for those individuals as we can.
Brian Whittle, followed by Anna Sarwar.
Thank you, Deputy Presiding Officer. I'd just like a clarification on the Cabinet Secretary's answer to Donald Cameron, and I appreciate that you cannot make it mandatory for everyone to take a test, but will the Cabinet Secretary make it mandatory for all care homes to offer testing to staff, residents and visitors?
Jean Freeman.
So I can't really do that either. However, what our clinical advisors are looking at, so you know at the minute, care homes have to meet certain criteria before different levels of testing are permitted by the local Directorate of Public Health. So my clinical advisor team are looking at what can we say about the requirement of testing, both the offer of it and the taking of it for example, the 4-hour visits. Now, we need to be careful with the latter in terms of not discriminating against residents and perhaps visitors for whom taking the test is not possible. And that's why we just need to be sure that we get that bit of it right. But I completely understand and agree with the sentiment behind both what Mr Whittle is asking me and Mr Cameron. And as soon as that is clear, I'll make sure that you are aware.
Anna Sarwar, followed by Alison Johnson.
Cabinet Secretary, after 8 months this is progress, but after 8 months, sorry, this isn't good enough. Full care home testing until the end of February. That'll be almost a year. Care home staff aren't celebrating today. They feel broken. Care home residents feel broken. Care home families feel broken. This isn't good enough. We're breaching their human rights and basic decency here. Almost a year till full testing.
You get to your question, please.
Will the Cabinet Secretary offer testing to families and to care home residents to allow them to have loved ones close to them on Christmas so that they can at least have some close contact, given the year that they've gone through and given that they might be with the final moments with those loved ones?
Jean Freeman.
So if Mr Asawa would like to read my statement, I think that answers his question. Can I just make another point that in February last year, NHS Scotland was capable of delivering 350 tests per day. I think the expansion that our staff, our virologists, our healthcare scientists, all of those policy and delivery staff have secured and achieved in the face of a pandemic and now with new innovations in testing is quite remarkable, and they should be considerably thanked for that and not looked at this through the glass half empty.
Alison Johnson, followed by Alex Cole-Hamilton.
Thank you. I'm delighted that all frontline NHS staff working in health and social care are finally going to be given weekly testing, something I and my Green colleagues have been calling for since April. And it is the least our doctors, nurses and carers deserve, but it has, Cabinet Secretary, taken 7 months to get to this point. And I'm slightly concerned that, well, Parliament voted last week for the Green motion calling on the Scottish Government to introduce routine testing for asymptomatic staff and senior pupils across Scotland's schools. And in her statement today, the Cabinet makes a tentative commitment to trials in January. I'd be very grateful if the Cabinet Secretary could tell us whether we'll have to wait another 7 months before our schools benefit from regular testing.
Jean Freeman.
So 2 things. First of all, it's not tentative. It is a commitment in discussion with the Deputy First Minister that from the return of schools in January, we will have those Pathfinder lateral flow programmes, and that is precisely to then ensure that we can have smooth deliverability, taking account of the point I made earlier to Ms Lennon about the authorisation of non-clinical use of lateral flow tests. That's the reason. It's a straightforward reason. I'm not hiding anything. That's what we'll do, and as soon as we can roll it out, we'll do it.
Alex Cole-Hamilton, followed by Stuart McMillan.
Thank you very much, Deputy Presiding Officer. News that lateral flow tests will be offered to students to confirm their COVID status before they journey home for Christmas will be welcome reassurance for families. But can I ask the Cabinet Secretary about the return to campus in the new year? Her statement hints that testing will be made available for that, but will that be offered to students while they are still at home so they can self-isolate there if needs be? Or are we going to run the risk of testing on campus and a repeat of the chaos that we saw this Freshers' Week?
Jean Freeman.
So I think I must have done something wrong when I was delivering that statement, because I didn't hint at this at all. I said it pretty clearly that as part of the plans for the return of students after the Christmas break, testing would be part of those plans. Now, those plans have to be worked through between the Deputy First Minister and Mr Lochhead and the university sector. And as they work those through, we will provide them with clinical advice about the most effective way of delivering that testing. But of course, we can only deliver that testing in Scotland. So where we have students travelling from elsewhere in the UK or elsewhere beyond the UK, that's not testing that we would deliver. So we need to reach a sensible approach to this in a way that minimises the risk as far as it is possible to do. And I have every confidence the Deputy First Minister will be setting out those plans once he has completed his necessary and perfectly proper discussions with University Scotland and the National Union of Students.
Stuart McMillan, followed by Jamie Green.
Thank you very much, Presiding Officer. I welcome the Cabinet Secretary's statement on the routine testing of healthcare staff, but can I ask if this will also include maintenance staff who may be required to enter wards or rooms with COVID-19 patients? This is something that's been raised with me by a constituent.
Jean Freeman.
Yes, it will. It will include estate staff who undertake a number of roles, and all of whom at various points in their job do have to enter patient wards and other areas where patients are. So it will include maintenance as well as other staff who are non-clinical.
Jamie Green, followed by John McAlpine.
Thank you. I do welcome plans for rapid testing to get students home for Christmas, but other young adults, many with disabilities, reside in other forms of residential care during term time. And they've been told that if they want to go home for Christmas, they must instead self-isolate for 14 days. And that surely is unacceptable to us all. Can the Cabinet Secretary provide reassurances that her commitment to getting students home for Christmas through testing will be extended to other young adults who deserve the dignity and respect that the rest of society afford?
Jean Freeman.
So the commitment I can give is that I will talk to my colleagues, Deputy First Minister and Ms Todd and others, to see if there is anything we can do in that regard, and make sure that once we've reached a view, I update Mr Green.
John McAlpine, followed by Colin Smith.
Thank you, Presiding Officer. The Cabinet Secretary knows I've been calling for the testing of carers to protect people with learning disabilities who have a very high rate of mortality from COVID. Many people with learning disabilities are in supported living, where the risks are similar to care homes, but the Cabinet Secretary didn't specifically name them today. The staff in these settings, unlike home care staff, are in the one place. Often they're employed by local authorities and they're not difficult to identify. Therefore, can the Cabinet Secretary offer any reassurance as to how soon these staff can be tested and why we can't just roll out the care home programme to cover them, given that they're easy to identify?
Jean Freeman.
So my apologies if that wasn't clear in this statement either, but this work will begin for those staff Ms McAlpine is referring to from mid-January.
Colin Smith.
Thank you, Presiding Officer. I welcome the plans for a system of 2 lateral flow tests 3 days apart for students leaving their term address. But can I ask the Cabinet Secretary why the Government has so far rejected this solution for passengers arriving at Scotland's airports, especially given that airports themselves would provide the test? What's the science that says it's a safe thing to do for students, but not the safe thing to do for airline passengers?
Jean Freeman.
So our clinical advisors are continuing to talk with the airport authorities in Scotland. They haven't yet reached a final view and a final agreement on that, but that work is underway. And as soon as we have that advice, then we will take steps to introduce whatever we're advised to do.
Alistair Allen.
Presiding Officer, many of my constituents work in the oil and gas sector, and they are typically asked to get tested before going offshore. However, as they cannot access testing privately in the islands, they often have to get tested in Aberdeen, adding days onto the length of their journey. While I understand the reasons why the testing machine in Stornoway is for people who are symptomatic, is there anything that can be done to improve things for people who find themselves caught up in this situation?
Jean Freeman.
So I appreciate the points that Mr Allen has made, and he has made them before, and I understand them. There's 2 things that are underway that may be of assistance in resolving this. The first of these is to look at what more we might do where there is underuse of existing capacity, either through the UK portal sites or directly through our NHS labs, although our NHS labs will now be fully utilised to a large extent by what I've announced today. The second is that we will now continue to look at sectoral arguments for asymptomatic testing, and that of course includes the particular circumstances of the oil and gas sector and individuals being offshore. Whether or not that offshore testing could be undertaken. It depends, again, we're back to this authorisation of the non-clinical use of lateral flow testing. But that consideration and that work is underway, and we'll make sure that we keep Mr Allen and other colleagues representing islands and the north east of Scotland updated as we make progress.
Pauline McNeill.
The City of Glasgow has a high transmission rate, but in Tier 4. I wonder if the Minister would agree with me, would it not make sense to extend asymptomatic testing to Glasgow, as you've done in Johnson, which is a very small part of the country? Or does this indicate how far behind we actually are in asymptomatic testing? Why can't people from Glasgow and wider Glasgow not get a test, particularly after the 5-day Christmas period, where it make good sense for people to volunteer to have one to fight the virus?
Jean Freeman.
So two things, and my apologies to Ms Lennon, I missed answering part of her question on Lanarkshire, so I hope I cover this now. The introduction of that community asymptomatic testing that I described, that we will see that from the start of December, is done in direct negotiation and consultation with local authorities. And so Lanarkshire will come forward. We've not excluded them. I'm not excluding anybody. Lanarkshire will come forward with their proposals, but at this point they are not finalised, so I'm not going to announce them because I'm not confident yet about what they exactly will be. They will come, but we don't have them yet. Glasgow does have particularly designated, again in discussion with the local authority and the local health board, a particular part of Glasgow that will have that community access testing at the beginning, asymptomatic testing at the beginning of December. But I also said in my statement that we will continue to look at whole town and whole city testing as we move into the early part of 2021. So we've worked out how to do the community access to asymptomatic testing with local authorities and other partners. That will happen in the early part of December. We have that at Renfrewshire site. That will give us a great deal of learning, as well as what eventually comes through to us from Liverpool. And all of that goes towards then looking, depending on the prevalence of the virus, other parts of the country where we will either be running asymptomatic testing at that community level or at the wider town or city level.
That concludes questions on the rollout of the testing programme. Apologies to Rona Mackay for being unable to reach her question. And we'll move on to the next item of business, which is a debate on motion 23450 in the name of Liam Kerr.